Yeah, that's quite a story. Lived in the San Fernando Valley and was driving back and forth because I'd met my future ex-wife here. And and I got in an auto accident, got rear-ended, and went and saw a chiropractor. A year later, it had changed my life completely. With all kinds of different ailments I had, and back pain, knee pain, you name it, I had it. It was very physical. My dad was a general contractor, so I started out kind of in the construction business. He warned me not to go into that business, so I picked a pool building. I don't know how that started, but then after that business went bankrupt, I took over the business and became a repairman and service tech. And then the auto accident happened. A year later, I asked the chiropractor, who happened to be a female, not that matters, if she would come to my house for dinner. And she said, I'm married. And I said, well, so am I. I'm not there to date you. I want to talk about your profession. She came over with her husband at about 7 p.m. and left about 3 a.m. At 9 a.m., I was at school signing up. Excuse me, I was signing up for school there. Little did I know at 29 years old I'd be changing professions and ended up going to school for the next 8.5 years. People don't realize this, but a chiropractor goes to school for the same amount of time as a medical doctor. You have the same hours. The only difference after your basic training, which is like 4, 5, or 6 years, I can't remember anymore, you split off and you go into your specialty, no matter what that is. But we're trained to be the same. I'm a primary care physician. I can do everything they do except for administer drugs. So that was kind of an interesting thing to think about, because people always tell you, oh, you're not a doctor. Yeah, I'm not a medical doctor, but I still am a doctor. And along with that comes some accolades and some issues also. So I've taken my lumps with that, joking around with being a chiropractor, but it's been a great profession. I've helped a lot of people, and I've seen a lot of lives change. So that was rewarding like there's no tomorrow. I have a bunch of stuff I could talk about. I don't really want to bore you. I just want to give you a couple stats, make you think a little differently outside the box, because we all think pretty much the same way about our health until something happens or something changes with you. And what I try to strive, what I talk to people now is, don't be the sheeple that everybody gets in the same line with. If there's 2 lines at the movie theater, go on the other line. You don't have to stand with everybody else when there's 10 people in one line and no one in the other line. Never could figure that out, but that's the mentality of how we kind of think. So going into the chiropractic field, we had to think a little bit differently because we were alternative medicine. And everyone thinks, when you're sick, you go to the doctor, you get a shot, you take a pill. Speaking of a pill, last week when Crystal was talking about that, something to look forward to in the later years of life when you're getting Medicare and you're looking for insurance and you need a certain drug that she was talking about. That could change now if you change your health today so you don't need that drug later in your life. People don't think about that. When I was 20, who thought about what you're going to do at 60 and 65? Okay, that was the last thing you were thinking about at 20 years old. Now that most of us are about 40, sorry, John. A little bit older, but we have to start thinking about our health and what's happening. Your body actually goes.
Get you on the golf course.
Love you, man. I've seen you golf though.
Yeah. I've seen you.
Where was I? As we get older, your body starts to degenerate or decay, if you will. Arthritis sets in. How many people here have seen a picture of their spine on an X-ray? Anybody? Okay, a few people. All right. So that gives you kind of an indication of what's happening to your body and how you're aging. Most people don't think about their health, like I said, until they start losing it, and then they start scrambling to find out what's wrong and then try to recover it. I can't remember the saying, something like people spend a minimal amount of money to stay healthy, but they'll spend their life savings recovering it. So you think about that, in my opinion, chiropractic is almost like a health insurance. You don't necessarily have to be in pain in order to see a chiropractor. It can be a wellness or a maintenance program. There's 2 types of fields in chiropractic: pain-driven and wellness care. I'm more of a wellness care doctor. I will see a person that's in pain. That's usually how a person comes into your office for the first time. Because normally they're not gonna, go into the office and go, hey, I want to be healthy. It's usually like, I have this problem and I'm tired of it and I want to get fixed. Can you help me out? So that's how we see the patient initially. We'll do a history consultation. That pretty much tells me exactly where you're coming from. And I have a little psychological test I do real quickly. I ask the patient, how much water do you drink a day? And speaking of which, there's 15 people here and only 6 people are drinking water. How much water do you drink a day? And they say, oh, I drink plenty. And I go, oh, how much is that? And they say, oh, I don't know, 3-4 glasses. The rule of thumb is you should be drinking your weight, half your weight in ounces. So if you weigh 200 pounds, you should be, drinking 100 ounces of water. You don't realize how much water that is. That's almost a gallon of milk if you think about the gallon you have in your refrigerator. So it starts in the morning and it goes through the day. You don't just sit there and guzzle the water. But anyway, so the test is, okay, from 1 to 10, 10 being excellent, how good of a water drinker you are. Somebody give me a number. Let's just say they say, I don't know, I'm at 7. Or no, I'll go backwards. They could say, I'm not very good water drinker, I'm 3. Okay, how's your diet? Because diet is part of your health. I'm like, I don't eat too well, it's, a 4. Okay, and I'll say, all right, so how's your overall health? And they're like, I'm an 8 or 9. See how it registers? It doesn't make sense. You can't be a poor water drinker and a poor diet person and then have really good health, because you're going to pay for that somewhere down the line. Your body needs those 2 things in order to function. And chiropractic is about functioning. The brain sends a signal through the central nervous system down your spine to make your body work. And if it doesn't get what it needs, it starts to work, but it works inefficiently. And then that's where the problems start. Even dehydration is a huge issue. Majority of the people that have a headache are dehydrated, okay? But they're taking the aspirin and everything else. Now they're destroying their kidney, their liver, their stomach, to try and get rid of the headache. Or if you have an injury that's chronic and you're taking a pain medication, you're doing the same thing. You're putting a Band-Aid on the pain, but you're destroying something else in your body. So, you need to look at something a little bit differently and get educated. People don't know about chiropractic because of the way we've been brought up, vaccinations, pills, medications, et cetera, et cetera. Today, the big thing in our industry is they're going to start mandating vaccination in all children that go to school, which is, my kids aren't vaccinated. I have 3 children, excuse me, and they were probably the healthiest kids I've ever seen. The neighbors kept saying, how come your kids don't ever get sick? I'm thinking, well, they get adjusted, Well, we have, my kids are sick every other week, and I see them constantly going to the doctor, getting antibiotics, time after time after time. You're lowering your immune system, so you're susceptible to getting sick all the time. The unfortunate thing is now people are so worried about what happens in school. They get these, if someone gets the chicken pox or the measles, they freak out. I don't know about you, but I don't know anybody who's died from that. Okay, this isn't 1940 and we have polio. Okay, so anyway, but to have a beautiful natural baby that's comes from the mom after 10 months of brewing in her, and she's healthy, or he's healthy as possible, and you stick, 36 drugs into this baby that's got the perfect immune system, that can cause a problem. And one of the problems and the controversial thing in our field is autism that comes from that, because the blood-brain barrier can't handle all those drugs at that early age. So it's a big fight. They're being forced to do that. There's a lot of people who don't think the drug model and are against that, but sometimes our politicians and people fight another way because they're scared or they don't know. And that's my point is most people don't know and they're not aware. The average American takes about 7 medications a day. It's a lot, okay? Depending on your condition, sometimes you have to. Got a heart condition or something like that. Even myself, I have to take medication. Not really for it, but sometimes you have to, make a choice what's better for you. 17% of all hospital admissions are caused by prescription drugs. And I can't remember the stat, but a large amount of deaths that are in the hospital come from medical mistakes. So if you have to go to the hospital, the old saying is, if they're going to operate on your right arm, get a marker and say, not this arm. Okay, in fact, they do that now. Before it was a joke, but now they actually do that because there's so many mistakes that have happened. You go in for take your right leg off and the doctor's looking at your left leg and it's his right. Something like that. Chiropractic manipulation reduces headaches by a percentage of probably 30 to 40%. Just at that alone, that right there is way less than the aspirins that you're taking over a year's time. and you're saving yourself some money on that one. Wellness versus pain, I've talked about that. You can be pain driven. I'm more of a wellness doctor. I like to find out your problem, try to correct it, stabilize it, and then maintain it. Like I said, most people come in for pain in the beginning, and then once they're out of pain, they realize how they felt. When they walked in that door, if they felt like a 4 and they left my practice after a particular situation, they were an 8, they never want to be a 4 again. He wants to come back and feel like a 4 versus an 8. Okay, so that's what made me drive to go to wellness versus pain. I'll just come back when the headache comes back. You're chasing the same problem over and over and over again, and you're spending twice the amount of money to try and fix a problem that never is going to be fixed because you're not trying to correct it. You're just maintaining it or putting a Band-Aid on it. 3 forms of health that make up our health: emotional, physical, and chemical. Chemical I kind of talked about, that's your nutrition. Emotional is how we believe, think, and our attitude. Okay, that's a huge, our brain is a huge factor in how our body works. So we want to look at all those components. And of course, physical is what we do. How do we exercise? What do we do with our body? How do we take care of it? So without, about food, just think about this. Our food today versus 1920 is completely different, and it's even changing again now. So people start going to the different healthier styles and eating all these different fads and diets. There's no such thing as a diet. It's a lifestyle of how you eat. A diet only works on the time that you're doing that particular diet in that time frame, because you're shocking the body for, 6 months or 6 weeks, whatever you're gonna do. And then once you change that lifestyle, your body will change again because the immune system and everything else takes over. So when I talk about diet, I always tell people, find something that works for you and then stick to that type of diet permanently, not just to lose weight. You'll lose weight if you do it right. The body's self-healing, self-regulating. If you cut your finger and you don't do nothing about it, it's going to stop bleeding eventually, and then it's going to heal. That's how powerful the body does recover. So you need to take care of your body so it does that. As we get older, it doesn't happen as quickly. It starts to have a problem. The diabetics have a real issue with that when they start getting, sores or something like that, or neuropathies in their feet and legs. That's where the diet, again, comes in to play. If you're not taking care of yourself, the body's going to be out of balance, and then you're going to start having issues. You got to start taking drugs, and then the whole game begins. So if you're taking care of yourself now, when you see Crystal at 65, you're going to be a lot happier, not having to buy the bigger policy. Okay, it's no different than a car or your teeth. The difference between the car and teeth, Dr. Mark, is you can get new teeth in a new car. You cannot get a new spine. You can't get a new body. You can get some new body parts, but you can't get a new body. So you need to take care of it as best as possible. Okay, I think I bored you enough. I really did some lecturing, a lot that really worked, and I was hoping that somebody would come up with a couple Q&As so I could, maybe quell some myths. Does anybody have any questions about their health or what they've heard about, or have a concern?
Twist in the wind.
Have you heard about, I saw an article that said something along the lines of it's 10% harder for people to diet these days because of environmental exposure to plastics and
Without a doubt.
medications?
Yes. Yes. We live in a toxic environment. So again, coming to the diet, nutrition, it's so important of how you can kind of combat that versus not even think about it, put your head in the sand, just go to the store and buy something. The best way to buy food at a grocery store is your outer aisles. Everything in the middle is processed and is there to stay there for months at a time because of how we grow our food, how we stock it, and how we have to preserve it. And believe it or not, the AMA and the FDA aren't together. Okay, one doesn't care about the other. It's just like cancer. Unfortunately, you're talking about a $11 billion business. You don't think we're smart enough to figure out why that cell gets mutated? Sure we can, but who's going to stop an $11 million business and put all those people out of business? It's really sad. But you know what, in my belief, if you can't find that with the technology we have, there's something fishy about that. Big Pharma is the biggest company in the world. They control us all. They're multi-billionaires, and they're just fooling you. So the toxic environment that you're talking about, Sean, is prevalent. It's there. The plastics, play a role. Your food plays a role. So it's important to kind of, you're not going to get away from it, but if you can try to scrutinize it and kind of skirt around it a little bit, or try to be as healthy as you can, educate yourself about it, you're going to be way better off than the average bear who doesn't, like I said, puts their head in the sand and doesn't think about it, just eats whatever. Pat?
So organic foods, are that, I mean, they're really organic?
Well, I'm old enough to say that when I ate food as a kid, all of it was organic. Okay, then they started malathion spraying and, you know, all this kind of stuff, and that's where it all started. And then you've got the farms that are out there, you know, spraying to keep the bugs and everything else out, or to get it, you know, get that fruit bigger and better, or protect it. So you're not going to get away from it. Yes, organic is organic. It's not completely organic, but it's way more organic than your natural food that you get when it's been sprayed or something like that. Dr. Mark?
What about GMO? Isn't that awful stuff?
Now you're getting back into the chemicals again, okay, and that's terrible. That's why they started, you know, getting rid of the when the food industry started changing again, that, you know, they started realizing what's bad in here, the pesticides, the GMO, et cetera, and they started. Some companies started to say we need to get rid of that, so because people are health conscious and stopped buying that type of food. So it's very prevalent in, you know, Japanese, Chinese food that was. They're thinking, oh, our sales are down, and we need to change something. And they started doing surveys and finding out that people weren't buying this type of food because of that reason. So again, when we talk about diets, I tell people if you're really serious about that, believe it or not, be a label reader. Believe it or not, that's going to give you some hints of what you're eating, what's in there. Like I said, we're not going to get away from it. We need to eat. So if you can, sometimes if you're going to scrutinize again your diet, look at the labels and find out what's in there. And today we have the technology to look anything up and see if it's good or bad or what their opinion is on the writings.
How prevalent is, you know, when you lay on a table, one leg longer
Yeah.
than the other?
Yeah. People always say, oh, I have one leg longer than the other. 5%.
But you know what I mean? Hip out.
Yeah, the hip is out of line, but people say that, and that's just kind of funny. They said, oh, and men see it from if they get their pants hemmed. It's kind of funny. We straighten them out, they come back and they go, hey, you made a mistake with my pants. No. No, you went to your chiropractor, your legs are attached to your hips, and the hips are even. If they're not, they do this. It shows one leg longer than the other. The problem with that is you have this large nerve bed in the lower part of your back that controls your lower body and lower intestines and everything else. So now you're putting interference or pressure onto the nerve bed, which is, again, your nerves. The nervous system is what controls you. So it's like running a car on 6 spark plugs when you should have 8. The car's still going to run, but you're going to get terrible gas mileage. You're still going to function with an unlevel hip, but your body's going to suffer for that down the line. And so if you're a man, do not sit on your wallet. That's the number one. As soon as I see that imprint in a man's pocket, I say, look, just stay home. If you're going to keep sitting on your wallet, and you're coming in here to get fixed, and I'm going to straighten you out, you're going to go back and sit on your wallet, just stay home and send me the check. All right, because you're not helping. You're only helping yourself for the time that you're in my office, okay? So same with the women, if you notice, or they carry as babies or as a purse, it's the same thing with them. They always carry it on the same side so they have a hand free to talk, write, cook, whatever they need to do. You need to change that up. Anything we do on a regular basis that's habitual and it's one-sided, you're going to have a little bit of an issue. That's why professional sports have all these huge medical teams to try and help these million-dollar athletes stay as top-notch as they can, because they're getting beat up and they're getting banged around and they're getting out of balance. And you're trying to, in today in the competitive world, you're trying to get the edge any way you can through nutrition, acupuncture, chiropractic, hocus pocus healing, I call it, and all that other kind of stuff. But it all does still work. Right in, Pat?
I went to a chiropractor a few years back, and he used this device that.
Right, it's called an activator. Okay,
Yeah,
so there's
activator.
different.
Is that as good as doing a?
Well, the activator was originally designed. It's a little gun that you just push and it makes this little sound. And what it does is it just takes this little, I don't know what to call it, but this shaft, if you will, with a little rubber end on it, and the impulse just goes like that. It was made for geriatrics and pediatrics. Mm-hmm. Pediatrics, obviously, once people start getting adjusted, my kids were starting to adjust at day 3. Okay, oldest person I adjusted was 99. So those people are fragile. So to use your hands, which we do, or different devices with the tables I have, a drop table and everything else, you have to be very careful about the pressure that you put on the nervous system. If I was over to push on anybody in a certain spot, I can make your body change immediately. And that's how powerful an adjustment is. People don't realize it until they start getting adjusted, right? Going, I never knew I could feel this way. I don't know what you did. I heard that cracking sound. We don't crack anything, or I won't get malpractice insurance. So it's called adjusting. What happens is you're moving the bone. You're making the crack you can hear is the bubble, the gas bubble that's in the joint popping. The joints are supposed to be laid parallel together, and what happens because we're machines, the joints move around, and then they settle in a pie-shaped form or something like this. Now there's a creation of a nitrous gas bubble that forms to fill that spot because there's no empty spaces in your body. And then the chiropractor goes in, he sees the high level or the low level of the side, he pushes it down, it pops. Now the joint comes back to normal, endorphins are released, serotonin's released, everyone goes, we call it the chiropractic orgasm because everybody loves the feeling. You know, you just love that feeling. That's why I said if you came in as a 4 and after 6 months of care you're at 8, you never want to go back the other way because you feel so good.
Yeah.
Mike?
Yeah. So I've come across people that when I tell them that I've been going for 5 years for maintenance, and they're like, why do you do that? And you must be spending a boatload.
Yeah.
Can you address that?
Yeah. First of all, chiropractic is probably the cheapest health care you're going to get. Okay, we're pretty affordable. You go to a medical doctor and buying the drugs, and you really look at that number. It's huge. Chiropractic is very reasonable. Like I said, I use it. I can tell people to think about it as a health insurance. You're investing in yourself now, so you don't have to spend more money with Crystal later by buying that stupid policy because you need that $1,000 a month drug. Okay. Why do people, I get this all the time, why do you keep going to the chiropractor? You go every week. Well, why do you brush your teeth? Okay, it's the same principle.
Every week.
Every day.
Yes, Sean, people come every week, okay? No, but it's up to the individual how they want to go and how they want to feel. And some people, like I said, really get into it and like it, and they have I try to find once I correct the problem, or if I can stabilize you as best as possible, or get you out of that initial pain you walked into, I try to find a window for you. How long does it take for you to feel that 4 again? And people, we can figure it out. I can tell when I'm adjusting you how well you adjust, how aligned you are, and then we kind of sit down and we talk about a game plan. I do have an office charge, but I put most people on a plan where they pay a certain amount for X amount of visits or a month, like a gym. I still do. I do an auto debit where, your card's just debited, whatever many visits you pick for that month. We don't have to worry about your payment. You don't have to worry about the payment. All you need to do is show up and make your appointment. So that's addressed all the time, and that's what I don't want to be crude, but that's just ignorance because people don't know. They're not dumb. They don't understand how it works. They don't know how it feels, and that's why they go, "Why do you do that?" And it's my job to educate people why they ask me that all the time. Or